So I'd like to explain to you the impact of fillers, use of hyaluronic acid to provide support and restore volume. As a case example, I'm going to use someone who's very familiar to myself, and that would be myself. If we look at this picture from 57 years of age, we can see a person that looks tired, who looks maybe a little less than happy. And this is at the end of a long office day when my office nurse injector says, you know, I think we can make you feel better about the image that you see in the mirror. As we analyze what's causing this dour look on my face, it's going to be volume loss. My cheeks have become hollow, leading to circles under my eyes. I've lost the support in my nasolabial folds. I've lost the support of the corner of my lips with the creation of a pregial sulcus and marionette lines. And as you can see, my lower lip is smaller than my upper lip. So for restoration, we're going to use hyaluronic acid. Now Danielle chose 3 different types of products. These products are going to be referred to as Juvederm family and Restylane family. We look at our shelves the same way a sculptor looks at their shelf with different tools, the way a painter looks at their palette with different colors to use and create different impacts. So in the cheeks we want a filler that's going to be strong. It's got shoulders, if you will, thicker to hold the cheeks up and to correct this crease under the eyes. Around the mouth we want something that's a little less full, that's going to lift the folds and create lift and support to the corners of the mouth. We're going to use something like Juvederm Ultra or Restylane Define in this area. In the cheeks, for something that's even thicker, you use something like Juvederm Voluma, or we're going to use something similar to Restylane Lift. In the lips, I like something that's going to allow mobility and movement. I found the Restylane family of products, both Restylane Define as well as regular Restylane, and most recently Restylane Define, to use in various parts of the lips to create support. So like an artist will use the palette of colors, we choose the correct filler from the Restylane or Juvederm family to correct the deficits that create the downward look to the face to create a more elevation and lift. With restoration of volume in my cheeks, you can see the eyes have been improved. Restoration of the corners of my mouth and the nasolabial folds eliminates these downward triangular lines, and the injection in my lower lips restores the ratio of upper to lower lip volume. And now look at this. This is the shirt that I was wearing. These pictures are 5 minutes apart, so this is an immediate impact that we get from fillers. And I had about 12 months of improvement in my cheeks, and I had even longer improvement in the corners of my mouth, more like 18 months for duration of these fillers.